The rookie nurse was completely invisible in the hallways of Charlotte Regional Trauma Center. The kind of person Dr. Bradford Cole, the most famous physician on cable television, an expert in everything, humble in nothing, never bothered to learn the name of. She worked the longest shifts, absorbed the cruelest comments, and never raised her voice. The entire hospital thought it knew exactly who she was. Then, military aircraft went down near the city. The emergency arrived in waves. The doctors panicked, and the nameless nurse set down her tray, picked up the radio, looked out at a room full of residents and senior physicians, and started giving orders. Not requests, orders. In a voice none of them had ever heard inside any civilian hospital in the world. What happened when the military survivors recognized her by rank will make you rethink everything you believe about who deserves to be called a leader. If that already has your attention, hit that like button right now. Drop a comment telling me where in the world you're listening from, and subscribe, because at Secrets of Silent Badges, every story we tell is built to stay with you long after it ends. Welcome to the channel. You're exactly where you're supposed to be. Move. You're in the way. Dr. Bradford Cole said it without looking at her. He said most things without looking at her. She stepped aside. Her tray shifted. A cup of saline nearly toppled, and she caught it with one hand before it hit the floor. Clean. Precise. The kind of catch that looked like luck, but wasn't. Nobody noticed. That was the point. The Charlotte Regional Trauma Center ran on 2 speeds: controlled chaos and absolute chaos. At 7:15 on a Tuesday morning, it was somewhere in between. Gurneys moved, monitors beeped, residents barked at each other in the hallway like they were performing for an audience. Dr. Cole was always performing for an audience. He stood at the center of the trauma bay with his white coat perfectly pressed, his name embroidered in blue thread above the left breast pocket, and his voice pitched just loud enough for the medical students to hear every word he said. "This is what incompetence looks like," he said, gesturing toward a patient chart. "Someone filed this without reviewing the labs. Someone cost this department 30 minutes. He looked around the room. His eyes skipped over the nurse standing near the supply cart. They always did. Her name badge said Hayes, M. RN. The M stood for Mara. Nobody called her Mara. Nobody called her anything. She was the nurse who worked the long shifts, who restocked supplies without being asked, who caught the medication errors before they became incidents, and who never once took credit for it. She was 36 years old. She looked older on bad days and younger on the rare mornings she forgot to hunch her shoulders. Her hair was ash blonde, pulled back in a tight bun that stayed perfectly in place through 12-hour shifts. Not the messy kind that came loose by noon. The kind that didn't move at all, as if the hair itself understood the value of discipline. Her eyes were storm gray. Most people didn't get close enough to notice. She wore her scrubs 2 sizes too large. The sleeves rolled down even in summer, the fabric hiding the burn scar on her left forearm and the pale horizontal line that crossed her right collarbone at an angle no nursing school in the country could explain. She moved carefully around the room, not slow, never slow, but deliberate. The way someone moves when they've spent years learning exactly how much sound a footstep makes. Hayes. One of the residents called her name without looking up from his tablet. Bed 4 needs a new IV line. Already done, she said. He blinked, looked at bed 4. The line was in, taped clean, no air in the tubing. He opened his mouth to ask when, and then decided he didn't need to know. That happened a lot with Mara Hayes. She was always 3 steps ahead and never announced it. Dr. Cole finished his performance at the chartboard and turned toward the nursing station. He picked up a coffee someone had left on the counter, drank from it without checking whether it was his, and began talking to the charge nurse about a scheduling conflict. He gestured with the cup. Coffee splashed toward the edge of the counter. It would have hit Mara's clipboard. She moved it 1 inch to the left, half a second before the splash, still without looking at him. The charge nurse, Sandra, saw it. She pressed her lips together, said nothing. Sandra had worked at Charlotte Regional for 19 years. She had seen a lot of nurses come and go. Most of them burned bright and fast. Some faded quietly. A few disappeared without explanation and were replaced by someone new who made the same mistakes until they didn't. Mara Hayes had been here 11 months. She didn't burn. She didn't fade. She just worked. Sandra thought about her sometimes late in shifts, the way you think about a question you're not sure you're allowed to ask. Hayes, Dr. Cole's voice, still not looking at her. I need the labs on the Kowalski case pulled and printed before rounds. They're on your desk, she said. A pause. I haven't been to my office yet. I know. Another pause, longer. How long have they been there? Since 6:40. He went back to his conversation with Sandra. He didn't say thank you. He never said thank you. Acknowledging a nurse would have required admitting that someone other than himself had done something that mattered, and Dr. Bradford Cole had built an entire television career on the premise that he alone was the one who mattered. 2 seasons on a medical cable network, 38 episodes. His face on a billboard outside the hospital parking garage. His signature in the hospital fundraising brochures under the headline, "The Doctor Who Changes Lives." He was very good at being visible. Mara Hayes was very good at being invisible. She moved through the morning the way she always did. Quietly, efficiently, absorbing information without appearing to. Cataloging exits, traffic patterns, equipment positions, not because she told herself to anymore, but because 11 years of training had built those habits into the architecture of who she was, and no amount of civilian life had touched them. At 9:10, Dr. Cole called her by the wrong name in front of 3 residents. "Henderson," he said, "get me a fresh chart for bed 7. Her name was not Henderson. Henderson had left the department 8 weeks ago. She got him the chart. At 10:30, a family came in with a child who had swallowed something small and sharp. Dr. Cole took the case because the mother recognized him from television. He handled it with visible warmth and allowed a resident to film the examination for his social media account while the child waited on the bed, pale and quietly frightened. Mara watched the child's color. She counted the breathing rate. She positioned herself 3 feet from the bed and held still, a fixed point in a room full of motion, until the child's oxygen saturation climbed back to 96, and Dr. Cole finished the segment and returned to the actual examination. Nobody noticed she had been standing guard the entire time. At 11:50, she ate lunch alone in the break room. A protein bar and black coffee, both consumed in under 4 minutes. She sat with her back to the wall and her eyes on the door, a habit so ingrained she no longer registered it as a choice. Her phone was face down on the table. She hadn't checked it in 3 hours. She was thinking about the horizon, not this one. The one she used to watch from 25,000 feet, from inside a cockpit where the curve of the earth was visible on clear days and the silence between her helmet and the canopy was total and absolute. Where the world below was a map. Where the only things that mattered were the aircraft and the mission, and the precise interval between identifying a threat and making a decision about it. She hadn't let herself think about that in a long time. She folded the protein bar wrapper into a square, twice, then again, and placed it in the trash. She went back to work. At 12:18, the radio at the nursing station produced a tone that Mara heard from the hallway. She stopped walking, not because of the volume, because of the frequency pattern. 3 short bursts, 1 long. She knew that sequence. She knew what it meant before the dispatcher's voice confirmed anything. She turned back toward the station. Sandra was already on the phone. Her face was doing the thing faces do when the news is worse than expected. The ER coordinator was pulling up the regional mass casualty alert on the main monitor. Dr. Cole was in a patient room and didn't know yet. Mara stood at the edge of the nursing station and listened to the voice on Sandra's phone without appearing to listen. Her expression held steady. Her hands stayed still at her sides. But something shifted behind her eyes. Something old. Something that had been waiting a long time to be necessary again. "What happened?" she said. It wasn't a question. Sandra looked up. For a moment she seemed surprised Mara was there. "Military aircraft," Sandra said. "2 of them. Lost over the county line. Multiple ejections confirmed. Ground impact. They're mobilizing everything." Mara's jaw tightened. Just slightly. Just once. "How many coming here?" "Dispatch says 6 to 14 critical. Maybe more." 6 to 14 critical patients. The trauma center had 4 bays at full operational capacity. 2 attending surgeons were currently in elective procedures. The backup trauma team was 42 minutes out under normal traffic conditions. Mara looked at the room. She counted, without moving her eyes in any way that would draw attention. Beds, staff on the floor, ventilators, blood product access, entry points, bottlenecks, the distance between the supply room and Bay 1. The angle of the ambulance bay doors and how many gurneys could move through them simultaneously without creating a fatal bottleneck in the first 3 minutes of a mass casualty event. 11 years of doing exactly this had left a permanent map inside her, and the map was already running the numbers. She was still running them when the first ambulance call came through, and then the second, and then the third, fourth, and fifth in under 90 seconds. The radio went loud, all of it, at once. And Mara Hayes, the nurse nobody looked at, the woman nobody knew, the person who moved through this hospital like a shadow with a name badge. She exhaled once, slowly, through her nose, and became someone else entirely. The first ambulance arrived at 12:31. The second came 90 seconds later. By 12:35, there were 4 units in the bay and 2 more inbound. And the Charlotte Regional Trauma Center had officially crossed the threshold from busy hospital into something it was not designed to handle alone. Dr. Cole emerged from the patient room at 12:32, still holding a tablet, still in performance mode. He looked at the organized chaos beginning to build in the corridor and raised his voice the way people raise their voice when they want to look like they're in control before they've assessed anything. "Someone give me a status report. Now." Nobody answered immediately. Sandra was on 2 phones at once. The charge coordinator was updating the board. The residents were moving toward the trauma bays with the urgency of people who were scared and trying not to show it. Mara was already at Bay 1. She had moved there quietly, without announcement, while Dr. Cole was still walking down the corridor. She had pulled on gloves before the first gurney cleared the ambulance doors. She had positioned herself at the head of the bay, where the airway was, where the first critical decision of any incoming trauma was made, and she had done it the same way she did everything, without making it a moment. The gurney came through fast. 2 paramedics, voices overlapping, hands still working. Naval aviator, male, mid-30s, ejection at altitude. Compression fractures confirmed T4 through T6. Pneumothorax left side, tension. BP's been dropping since extraction. GCS on scene was 12, dropped to 9 in transport. Mara looked at the patient. Flight suit still partially on, helmet off. The collar was in place but slightly rotated. The paramedics had moved fast and the geometry wasn't perfect. His lips had the wrong color for his skin tone. His chest was moving asymmetrically. The left side wasn't rising the way the right side was. She knew that picture. "Left tension pneumo," she said. It was a statement. The resident at her side, Dr. Patel, 2nd year, competent but hesitant, looked at the chest X-ray beginning to load on the bay monitor. "We should wait for imaging to confirm." "There's no time to wait for imaging," Mara said. Flat, certain, not unkind. "His trachea is starting to deviate." She pointed without touching. "Watch his neck. Right side. You can see the shift." Patel looked. He saw it. His face changed. "We need a needle decompression," Mara said. "Second intercostal space, mid-clavicular line. 14-gauge angiocath, right now." "That's a physician call," Patel said. It was reflex, not argument. "Then make the call," she said, "because he has about 90 seconds before his heart shifts far enough to stop." Patel looked toward the corridor for Dr. Cole. Dr. Cole was at the bay entrance, managing the incoming flow with the kind of broad gestures that looked authoritative on television. He hadn't assessed a patient yet. Patel looked back at the patient. He looked at Mara. She was already holding the angiocath. "I'll walk you through every step," she said. "Your hands, your call, your documentation. I'm right here." Something in Patel's posture made a decision. "Do it," he said. She placed the needle at the correct landmark, with a precision that didn't belong in hesitation. Second intercostal space. Mid-clavicular line. Angle correct. Depth correct. When the catheter entered the pleural space, the hiss of escaping air was immediate and audible. The patient's left chest began to rise. The monitor showed blood pressure climbing within 40 seconds. 91/60, 94, 97. Patel exhaled through his mouth. "How did you know it was that far progressed?" he said quietly. Mara was already securing the catheter. "Chest wall tension pattern," she said, the way his shoulder was riding. Neck vein distension on the left. She stripped her gloves. "Call for a chest tube next. He'll need it before surgery." She moved to Bay 2 before Patel could ask anything else. Bay 2 held a second aviator, younger, conscious, barely. Flight suit shredded at the left leg. The femoral area was packed with a field dressing already soaked through. Applied by someone who knew what they were doing, probably another crew member who had extraction training. But the pressure had shifted in transport, and the dressing was no longer effective. Junctional hemorrhage. One of the 3 locations on the human body where a standard tourniquet cannot reach. One of the locations where people die waiting for someone to know what to do. The nurse on Bay 2 was doing her best. Her best was not enough for this. Her hands were pressing, but the angle was wrong. And pressure against the femoral artery at the inguinal junction required a technique that general nursing programs did not typically cover in the depth that the next 30 seconds required. Mara stepped in without asking permission. "I need you to hold here," she said to the nurse, repositioning the woman's hands with calm, deliberate pressure. "Not like that. Like this. You're pressing toward the mattress. You need to press toward the pelvic bone. That's what stops the bleeding." The nurse adjusted. "Hold it exactly there," Mara said. "Don't move for 3 minutes, even if your arms burn. Even if he moves, don't move." "Okay," the nurse said. Her voice was shaking. "You're doing the right thing," Mara told her. "Keep going." She looked up. Dr. Cole was standing at the entrance to Bay 2. His arms were crossed. His face carried the expression of someone who had just seen something he didn't understand and had already decided it was a problem. "Hayes," he said. She looked at him. "Who authorized you to direct clinical procedures in this bay?" "The patient is hemorrhaging from a junctional wound," she said. "The pressure technique being applied wasn't stopping it." "That is not an answer to my question." She held his gaze. Her voice stayed level. "Dr. Patel is the physician of record in Bay 1. Dr. J. Marcus is incoming for Bay 2. The patient needed immediate intervention. I intervened." "You're a floor nurse," Cole said. "Yes. You don't direct clinical care." "I repositioned a hand to correct a pressure angle," she said. "The patient's pressure is holding. If you'd like to take over, I'll step back." She said it cleanly. No edge. No invitation to escalate. Cole stared at her for a moment. Then his pager went off. Then Sandra appeared behind him with 3 simultaneous pieces of information requiring his attention. He turned away. Mara turned back to the bay. 3 more gurneys came through the doors in the next 4 minutes. A loadmaster with blast injuries to both hands. A crew chief with a head laceration and a GCS that had dropped 2 points since pickup. A pilot, another one, older, silver at the temples, with a crush injury to the right leg and a respiratory pattern Mara clocked immediately as wrong. She moved between bays without rushing. She didn't run. Running spread panic and burned energy and made other people freeze. She moved at the pace that communicated. "This is manageable. I know what I'm doing. Follow my lead." Not everyone followed, but more did than she expected, At 12:52, the radio at the nursing station announced 2 more inbound, a flight surgeon accompanying a critically injured aviator, and 1 additional patient whose status was listed as unknown pending stabilization in the field. Mara was restocking gloves when Sandra appeared beside her. 6 of the patients who came in, Sandra said quietly. 3 of them have asked the same question. Mara looked at her. They're asking who's in charge out here, Sandra said. Not the doctors. Specifically, they're asking about the nurse. Mara went still for 1/2 second. 1. Then she pulled on a new pair of gloves. Tell them someone's handling it, she said. She walked back to her post. At 1:15, Dr. Cole called a team meeting in the corridor. He positioned himself at the center of the hallway with his back to the trauma bays and spoke at a volume calibrated for maximum reach. Around him, residents and nurses formed the loose circle of people who had learned that standing too close meant being volunteered for something. We are managing a mass casualty event, he said. I want clear lanes, bay assignments, no freelancing. Every clinical decision goes through me or through Dr. Marcus. That is the protocol, and that is what we follow. He looked around the circle. His eyes landed on Mara. That means nursing staff stays in their lane, he said. It wasn't directed at the group. It was directed at one person. Everyone in the circle understood that, including the person it was directed at. Mara didn't respond. She was standing at the outer edge of the circle with a chart in her hand, and she was watching the doors. Not Cole. The doors. Because she had heard the radio call that had come through 40 seconds ago while Cole was positioning himself for his address, and she had done the math, and the math said that what was coming through those doors in approximately 90 seconds was not going to wait for a lane assignment. Cole kept talking. The doors opened. The gurney came through at speed, and the paramedic at the rear was compressing a bag valve mask with one hand and holding a field radio with the other. And the man on the gurney was in a flight suit with the rank insignia still visible above the left breast, a lieutenant commander. And his color was the gray that meant the body had already begun to redirect blood away from the periphery toward the core, which meant the core was losing. GCS-4, the paramedic said. Found unresponsive at the ejection site. No external hemorrhage identified. Vitals in transport. BP 60 over palp. Heart rate 142. Respirations absent without BVM assist. Pupils unequal. Right blown. The circle broke. Residents scattered toward bays. Cole moved toward the gurney with his tablet raised, already asking questions that the answers to didn't matter yet. Mara was already at the head of the gurney. She had moved before Cole, not past him, around the outside of the circle while he was still talking, so that by the time the gurney cleared the doors, she was already in position, at the airway, where the first 60 seconds of this man's survival would be decided. He needs a surgical airway, she said. Cole stopped walking. Excuse me. BVM isn't moving air effectively. Listen to the left chest. She didn't look up. He's got something obstructing above the cords. Edema probably. Blast compression on ejection can do it. The bag's inflating, but the oxygen isn't exchanging. Cole stepped to the gurney. He listened with his stethoscope. Both sides. He said nothing for 3 seconds. Then he said, "We'll attempt intubation first." "Intubation won't clear a supraglottic obstruction," she said. "Hayes, his SAT is 71. She pointed at the monitor. "It was 78 when he came through the doors. It's dropping while we're talking." Cole's jaw tightened. "I am aware of the oxygen saturation. Then you know we have about 40 seconds. The room was very quiet, not silent. Monitors beeped. Somewhere in Bay 1 someone called for blood products. The ambient noise of a working trauma floor continued without pause. But the space immediately around Bay 3 had gone still in the way spaces go still when everyone present understands that something irreversible is about to be decided. Dr. Marcus appeared at the Bay entrance. Senior trauma attending, 15 years in the department, a man who had the particular stillness of someone who had seen enough emergencies to stop performing inside them. He assessed the scene in 2 seconds. "What's the airway status?" he said. "Supraglottic obstruction suspected. Mara said. Sat 71 and dropping. I'm recommending surgical crick. Marcus looked at the monitor, looked at the patient, looked at Mara. Do you have a kit? He said. In my hand, she said. It was true. She was already holding the cricothyrotomy kit. She had taken it from the supply cart when the gurney came through the doors, before the patient's chart had been opened, before anyone else in the room had processed what they were looking at. Marcus nodded once. Walk me through your landmarks, he said. It was a test, a fast one. The kind given not to students, but to people whose competence you need to verify in under 10 seconds, because lives depend on it, and you don't have time for anything longer. Mara answered without hesitation. Thyroid cartilage, inferior border. Drop 1 centimeter to the cricothyroid membrane. Horizontal incision, 1.5 centimeters. Hook and dilate. Tube goes in bevel down, secure, and ventilate. Marcus said, do it. Cole said, Marcus. Do it, Marcus said again. To Mara, not to Cole. She worked. Her hands moved with a precision that had nothing to do with the environment she was standing in. The lighting in Bay 3 was standard hospital fluorescent. The tray was metal and slightly cold. The patient was moving under the oxygen deprivation in the directionless way that deeply unconscious people move, and none of it touched her. The incision took 11 seconds. Correct depth, correct angle, no secondary bleed. The hook went in. The dilation was smooth. The tube seated on the first pass. She connected the ventilation bag and squeezed once. The chest rose, both sides, symmetrical. The monitor alarm changed pitch. Oxygen saturation, 71, 76, 82, 88, 92, 95. The room exhaled. Patel, standing against the far wall with a chart he had forgotten he was holding, said something under his breath that wasn't a medical term. Sandra stood at the bay entrance with both hands pressed flat against the door frame. Dr. Marcus secured the tube himself, checked the placement twice, and then straightened and looked at Mara across the patient's chest. Where did you train? He said. It was a genuine question. The tone of a physician who has just watched a procedure done correctly under pressure and needs to understand the context. Mara stripped her gloves. Nursing school, she said. Marcus looked at her. She held his gaze. She did not look away, and she did not elaborate. And after a moment, Marcus looked back at the patient and said, Someone get me a portable CT for this man, and I want a blood gas in 5 minutes. He moved to the next bay. Cole had not moved. He was standing 3 feet from where he had been standing when Marcus gave the order. His tablet was still in his hand. His face had gone through several expressions in the last 90 seconds, and had settled on the one that forms when a person's understanding of a situation has been fundamentally disrupted and they have not yet decided what to do about it. He looked at the monitor. Sat 95, heart rate coming down from 142 to 128. He looked at the tube, correctly placed, secured with the tape geometry of someone who has done this enough times to have developed a preferred method. He looked at Mara. She was already moving to the next bay. He didn't call after her. At 1:40, the sliding doors opened again, and this time what came through was not a gurney. It was a man in a flight suit walking under his own power, which was remarkable given the blood on his left arm, and the way he was favoring his right side, and the fact that he had almost certainly ejected from an aircraft in the last 2 hours. He was tall, mid-40s, with close-cropped dark hair, and the kind of posture that exists in people who have spent decades understanding that their physical bearing communicates information. He stopped inside the doors. He looked at the trauma floor. He assessed it the same way Mara assessed rooms, not dramatically, not with any visible pause, but with the quiet, comprehensive scan of someone trained to understand environments under pressure. His eyes moved across the bays, across the staff, across the boards, and then they stopped. Mara was at the supply cart between bays 2 and 3, replenishing gloves and marking a chart simultaneously. She was not doing anything remarkable at that particular moment. She was doing exactly what a nurse does between crises, the ordinary work that holds a trauma floor together between the moments that get remembered. The man in the flight suit looked at her for 3 seconds. Then he said one word, not loudly, not to anyone in particular, just into the room, the way you say something when you recognize something you were not expecting to find. "Commander." Mara's hand stopped on the chart. She did not turn around immediately. She completed the notation she was writing. The pen finished its line. The chart closed. Then she turned. She looked at the man. He was looking at her with an expression that was not confusion and was not surprise and was not the simple recognition of someone who thinks they've seen a familiar face. It was the look of a person who has just confirmed something they could not quite believe. His right hand came up, not a wave, not a gesture, a salute. Clean, precise, held. From a wounded man in a torn flight suit, in the middle of a civilian trauma floor, directed at a woman in oversized scrubs with a hospital name badge that said, Hayes, M. RN. Mara stood very still. The entire floor seemed to slow around her. Patel saw it from Bay 1 and stopped writing. Sandra saw it from the nursing station and set down the phone without hanging up. Dr. Cole saw it from the corridor, and something in his face shifted in a way it had not shifted all day. Mara looked at the man for a long moment. Then she crossed the floor toward him, took his arm gently, and guided him toward a chair. "You're bleeding," she said quietly. "Let me look at the arm." "Ma'am," he said. "The others, did they make it?" "Most of them," she said. "Sit." He sat. She began cutting away the flight suit sleeve above the wound, her hands steady, her expression neutral, her eyes running the fast clinical assessment that had become as automatic to her as breathing. But her jaw was set. And her shoulders, for the first time all day, were not hunched. They were back, squared, military straight. As if a posture she had been suppressing for 22 months had simply decided it was no longer willing to hide. His name was Commander David Rourke. Mara knew that before he told her. She had recognized the squadron patch on his flight suit before he crossed the floor. VFA 143, the Pukin Dogs, out of Ennis, Oceana, Virginia. She had flown with pilots from that squadron twice, in circumstances she was not going to think about right now. In airspace over water that didn't appear on the maps she was allowed to discuss in civilian settings. She worked on his arm without looking at his face. The laceration ran from mid-forearm to the elbow crease. Deep enough to need closure, not deep enough to have hit anything critical. The bleeding had slowed on its own, which told her the ejection hadn't compromised his vascular integrity. What it had done was drive a fragment of something, seat material, canopy debris, impossible to know without imaging, into the subcutaneous tissue just below the radial border. She could feel it under her gloved fingers. She didn't comment on it yet. "The lieutenant commander from Bay 3, Rourke said. His voice was controlled. Combat controlled, the flatness of someone managing fear by organizing it into information. "Calloway, how bad?" "He's stable," she said. "Airways secured. He's going to CT." Rourke exhaled through his nose. "He has a daughter," he said. 8 months old." "I know," she said. She didn't know. But she said it the way you say it when the information doesn't change what your hands are doing, and the person across from you needs to hear that someone in the room understands what is at stake beyond the clinical picture. Rourke looked at her hands. He watched her work for a moment. "You did the crick," he said. "It wasn't a question." "Dr. Marcus authorized it," she said. "That's not what I asked." She applied the closure strips with even spacing, the way they had taught it at a field medicine course she had attended in a building that no longer existed on a base she was not supposed to name. "How long have you been here?" Rourke said. 11 months. Before that?" She kept working. "Commander," he said. "I'm a nurse," she said. "You were a nurse for about 6 minutes this afternoon," he said. "The rest of the time you were running a mass casualty response, and you did it correctly. You did it the way someone does it who has done it before, in conditions that make this look organized. She secured the last closure strip. She sat back. She looked at him for the first time since she had sat down with him. A real look. Not a clinical assessment, but an actual exchange between two people who were no longer pretending the conversation was only about his arm. You need imaging, she said. There's a fragment in the subcutaneous tissue below your radial border. I can feel it. It's not moving, but it needs to come out under controlled conditions. I've had worse, he said. I didn't say it was the worst thing I'd seen today, she said. I said it needs to come out. The corner of his mouth moved. You haven't changed, he said. She stood. She pulled off her gloves and dropped them in the waste receptacle and picked up her chart without looking at him. I'll get Dr. Marcus to see you, she said. Mara. She stopped, not because the name surprised her. Her name was on her badge. Anyone could read it. But because of the way he said it. The weight of it. The way a name sounds when it's said by someone who knew you before you became someone else. She turned slowly. I'm going to have to report where I found you, he said. His voice was even, not a threat. A statement, the kind made by a man who understands his obligations and isn't apologizing for them. You know that. You don't know who you found, she said. I know exactly who I found, he said. I flew with you for 3 years. I was on the Truman when you got your second air medal. I was in the ready room the night the notification came through about what happened over the strait. I know your hands, Mara. I know how you move. And I just watched you save Calloway's life with a procedure that takes most surgeons 3 tries to get right. The trauma floor continued around them. Monitors, voices, the ordinary machinery of a place working at capacity. Mara stood very still. I left, she said. I know. I left for reasons. I know that too, he said. And I'm not here to pull you back into anything. But I am going to have to make a call. And before I do, I need to know you're okay. She looked at him. He was watching her with the attention of someone who actually wanted the answer. I'm working, she said. That's not the same thing. It's enough, she said. For now. She walked away. She was 3 steps from the chair when Dr. Cole appeared from the corridor at an angle that suggested he had been close enough to hear at least part of the conversation and had decided this was the moment to make that into something. Hayes. His voice was clipped. My office, when the floor stabilizes. She kept walking. That wasn't a request, he said. I know, she said. The floor isn't stable yet. She went back to work. At 2:20, a black SUV pulled into the ambulance bay. It was not an ambulance. It had government plates and no markings, and the 2 men who got out of the front were in civilian clothes that fit the way civilian clothes fit on people who are not civilians. They moved through the ambulance bay with the practiced indifference of people who go places they're not invited to and have stopped needing to explain it. Sandra saw them from the nursing station. She picked up the desk phone and said nothing into it, which was its own kind of message. Mara was in the supply room when she registered the change in the floor's ambient noise. Not louder, different. The frequency shift of a space where everyone has collectively noticed something and is collectively pretending they haven't. She came out of the supply room. She saw the men. They saw her at the same moment. The one on the left was about 40, square face. The kind of stillness that comes from training, not temperament. His eyes did the same room scan hers had done all day, and when they landed on her, they stopped with the same quality Rourke's had, not surprise, but confirmation. He said something to the man on his right. The man on his right nodded. They walked toward the nursing station. Mara watched them from the corridor. Her heart rate had not changed. That was one of the things the years had done to her. Her heart rate simply did not change anymore in response to threat recognition. It was a useful adaptation that had cost her something she couldn't fully name. Cole intercepted the men at the nursing station. He introduced himself with the full weight of his name and his title and his television credits, which was exactly the wrong approach with exactly these people. And Mara could see from 20 feet away the polite patience on the face of the man on the left that meant he was going to wait for Cole to finish and then proceed as though none of it had been said. Cole gestured toward the trauma floor. The man on the left nodded. Cole said something else. The man nodded again. Then he looked past Cole, directly across the floor, to where Mara was standing in the corridor. Cole turned. He looked at Mara. He looked back at the men. Something rearranged itself in his understanding of the day. Mara stayed where she was. The man on the left crossed the floor toward her. Cole followed, because Cole was not the kind of person who allowed conversations to happen around him. "Ms. Hayes," the man said. "Yes," she said. He produced a credentials wallet. She looked at it. She didn't need to look at it long. "I'm going to need 5 minutes of your time," he said. "The floor is still active," she said. "I understand. This won't take long." Cole was beside him now. "Whatever this is about," Cole said, "I should be included. She's on my staff and anything involving a member of my department." "Thank you, Doctor," the man said, without looking at him. "This is a personnel matter. We'll be brief." He looked at Mara. She looked at him. She thought about Rourke, still in the chair by the supply cart, watching this from across the floor with his bandaged arm resting on his knee, and an expression that said he had made his call and was waiting to see what came next. She thought about the oxygen saturation climbing from 71 to 95 on a monitor in a hospital she had chosen, because it was 5 states from the last place she had been someone people knew. She looked at Cole. He was staring at her with an expression she had never seen on his face before. Not dismissal, not performance, something closer to the first honest thing she had seen from him all day. She looked back at the man with the credentials. 5 minutes, she said. His name was Hendricks. He didn't offer a first name, which told her everything she needed to know about the nature of the conversation they were about to have. He led her to the small family consultation room off the main corridor, the one with the frosted glass panel and the box of tissues on the table that nobody ever used because the people who sat in that room were usually past the point where tissues helped. The second man stayed outside the door. Mara sat across from Hendricks with her hands flat on the table and her expression neutral, and her posture the careful civilian approximation she had spent months refining. Hendricks opened a folder. He did not turn it toward her. "You've been at Charlotte Regional for 11 months, he said. "Yes. Before that, 14 months in Asheville. Before that, 8 months in Knoxville." He looked up. "You move. Nursing is portable," she said. "It is," he agreed. He looked back at the folder. "Commander Mara Elise Calloway Hayes, United States Navy, VFA 143, then NSAWC, then a classified detachment out of Bahrain that I'm not going to name in this room." He paused. "Separated from service 22 months ago, medical technically, though the paperwork on that is—" He turned a page. "Creative." She kept her expression flat. "The separation was your idea," he said. "The separation was agreed upon," she said. "By people who didn't want the circumstances to become a record," he said. It wasn't an accusation. He said it the way you say something factual, something that has already been processed and filed, and is now simply being acknowledged between 2 people in a room. You had a mission go wrong over the Strait of Hormuz. You made a call. The call was correct. The people above you disagreed about the method. "The people above me," she said carefully, "were not in the aircraft." "No," he said, "they were not." Silence. The consultation room had a ventilation hum that was too loud for its size. Mara had noticed it the first week. She noticed it now the way she noticed everything. Catalogued, filed, not dwelt upon. "What happened today," Hendricks said, "was observed by Commander Rourke, by Dr. Marcus, by at least 6 of the incoming patients, and by approximately 14 members of the nursing and medical staff." He closed the folder. 3 of the patients have already submitted written statements. They did it in the Bay, on their phones, while they were still being treated. 2 of them were concussed. "People do things when they're grateful," she said. "People do things when they've seen something they need to document," he said. "There's a difference." He leaned back slightly. "The statements describe a nurse who ran a 14-patient mass casualty response with no formal authority, performed a successful emergency surgical airway, correctly identified and directed treatment for 2 junctional hemorrhages, coordinated bay assignments ahead of the attending physicians, and did all of it while a senior physician actively attempted to sideline her." He looked at her. "That's a compelling picture." "It's an incomplete one," she said. "All pictures are," he said. She held his gaze. "What do you want?" she said. Hendricks was quiet for a moment. "There's a program," he said. "It's been running for about 14 months. Embedded medical personnel, specifically people with operational backgrounds, placed in civilian trauma centers near high-traffic military corridors. Charlotte is one of the corridors. The research coming out of the program is—" He paused. "Significant. The outcomes data for military casualties who happen to present to a facility with an embedded operator is materially different from the data for facilities without." "You want a study subject?" she said. "No," he said. "We already have study subjects. We want the person who can look at 14 incoming casualties from 2 downed aircraft and correctly triage every one of them before the attending physician has finished introducing himself." She looked at the table. She thought about the life she had been building here, slowly, carefully. A life that fit inside the dimensions of a lease and a name badge and a protein bar eaten alone. A life that was small enough to be invisible and quiet enough to be bearable. She thought about how it had felt today. She didn't want to think about how it had felt today. "I'd like to go back to the floor," she said. Hendricks nodded. He did not push. Whatever he was, he understood timing. "The offer doesn't expire today," he said. He closed the folder and slid a card across the table. Plain white. Number only. "Take whatever time you need." She looked at the card. She picked it up. She stood. She was at the door when he said, "One more thing." She stopped. "Dr. Cole," he said. "He filed a complaint with hospital administration 40 minutes ago. Unauthorized clinical intervention. Conduct outside scope of practice." He paused. "We've been asked to provide context for the investigation." She turned. "What kind of context?" she said. "The accurate kind," he said. She held the door handle. "That will complicate things for him," she said. "Yes," Hendricks said. "It will." She went back to the floor. Cole was at the nursing station. He was not performing. That was the first thing she noticed. His white coat was still perfect, his name still embroidered above the pocket. But the architecture of his usual presentation had shifted into something smaller and less certain. The way structures look after something has moved the ground beneath them. He saw her come out of the consultation room. He saw the man who had been standing outside the door step aside and watch her cross the floor. Cole said nothing when she reached the station. She picked up the chart she had left there. She looked at the board. 2 patients still in active monitoring, 1 pending surgical consult. The mass casualty had peaked and was descending, the floor returning to its normal frequency from the elevated pitch of the last 2 hours. "Hayes," Cole said. She looked at him. He was quiet for a moment, the kind of quiet that means something is being assembled internally and hasn't finished yet. "The patient in Bay 3, he said. "Calloway." "Lieutenant Commander Calloway," she said. "Yes." A pause. "He's recovering." "He is." "The surgical airway," Cole said. His voice was careful. Each word placed with deliberate distance from the ones around it, the way someone moves through a space they suddenly understand is less stable than they assumed. "The outcome was correct," she said. Not unkind, not triumphant, just the word. "Yes," he said. She looked at the board again. She made a notation on the chart. "The complaint you filed," she said. Cole said nothing. You should know that the patients who were present have provided statements, she said. Dr. Marcus will also be providing a statement. Hendricks, she paused. From the federal side, will be providing context. She looked at him. I'm not telling you that to threaten you. I'm telling you so you can make an informed decision about whether to proceed with it. Cole stood very still. 14 years of television. 38 episodes. A billboard in the parking garage. A career built on the premise that he was the one in the room who mattered.